Imagine going out for a night with your friends, dancing, laughing, completely unaware that the air around you carries something invisible and deadly. You wake up the next morning with what feels like a headache and a sore neck. You assume it's a hangover, but within hours, you can't stand up. Within a day, you're fighting for your life. This is not a horror movie. This happened in Canterbury, England, and the world is watching. Welcome to BioWell Hub, your trusted space for breaking down the science behind the health stories that matter. Today, we are diving deep into the UK's most alarming and rapidly spreading infectious disease outbreak of 2026. The Meningitis B crisis that has already claimed 2 young lives and shows no signs of slowing down. If you've been following this story on the news, buckle up, because we are going further than the headlines. It all traces back to a single nightclub, Club Chemistry in Canterbury, England. On the evenings of March 5th, 6th, and 7th, hundreds of students gathered there for what was supposed to be just another night out. What nobody knew was that at least one person in that crowd was carrying Neisseria meningitis, the bacterium responsible for meningococcal disease. This microbe is a silent traveler. It lives in the back of the nose and throat of roughly 1 in 10 people at any given time, causing them absolutely no harm. But in the right conditions, close contact, shared drinks, kissing, even prolonged breathing in a crowded indoor space, it can jump from person to person, and in some individuals, it crosses the blood-brain barrier, triggering one of the most violent infections the human body can face. By the weekend of March 15th, hospitals in Canterbury were overwhelmed with severely ill young adults presenting with symptoms consistent with meningococcal disease. The UK Health Security Agency, or UKHSA, launched a full-scale national response. Contact tracing began immediately, and within days the numbers started climbing in a way that stunned even the most experienced public health officials. As of March 18, 2026, 15 laboratory-confirmed cases and 12 probable cases have been recorded, a total of 27. 2 people have died. One was a 21-year-old university student. The other was a young schoolgirl named Juliet, a pupil at Queen Elizabeth's Grammar School in Faversham. 2 bright young lives gone. Susan Hopkins, the chief executive of UKHSA, described what she witnessed as explosive and unprecedented. She said in her 35 years working in medicine, she had never seen this many cases in a single weekend from this type of infection. Deputy Chief Medical Officer Dr. Thomas Waite called it the fastest-growing outbreak he had seen in his career. An event of national significance. When the people who dedicate their careers to containing disease outbreaks are using words like explosive and unprecedented, you know this is serious. Now let's talk science, because that is what BioWell Hub is all about. The strain causing this outbreak is meningococcal group B, or Men-B. It is one of the most dangerous forms of the bacteria, responsible for the majority of meningitis cases in teenagers and young adults in the UK. What makes Men-B so terrifying is its speed. Early symptoms, fever, headache, stiff neck, sensitivity to light, vomiting, can easily be dismissed as a cold, the flu, or even a hangover. This is critically important. Students are at particular risk of missing the early warning signs precisely because those signs mimic the kinds of everyday illnesses that are common in university settings. But Men-B does not wait. Early symptoms can escalate to severe deterioration within hours. One of the most recognizable signs of meningococcal septicemia is a dark, blotchy rash that does not fade when you press a glass against it. If you see that rash, you call emergency services immediately, because at that stage, every minute counts. So what is being done? The response from UK authorities has been rapid and large-scale. Over 2,500 doses of preventive antibiotics have already been administered to students, close contacts, and anyone who visited Club Chemistry during those critical 3 nights. A single course of antibiotics is highly effective at preventing the disease from developing and limiting its spread in around 90% of cases. GPs across the entire country have been instructed to prescribe these antibiotics to any student who has been asked to seek preventive treatment, recognizing that many students have already traveled home from Canterbury. The outbreak has already reached beyond Kent's borders, with one confirmed case in a student at a higher education institution in London. Beyond antibiotics, a targeted Men B vaccination program has been launched for approximately 5,000 students living in the halls of residence at the University of Kent's Canterbury campus. However, it is critical to understand that the vaccine alone will not stop this current outbreak. The Men B vaccine requires 2 doses given several weeks apart, and full protection takes additional time after the second dose. Vaccination is essential for long-term protection, but right now, antibiotics are the frontline weapon. This outbreak also exposes a significant gap in the UK's vaccination policy. Since 2015, only infants have been routinely vaccinated against Men B. That means an entire generation of teenagers and young adults has been left unprotected against one of the most common causes of meningitis in their age group. Health Secretary Wes Streeting has already asked experts to re-examine vaccination eligibility in light of this crisis. It is a conversation that is long overdue. The bottom line is this: Meningitis B is rare, but when it strikes fast, and it strikes hard. 1 in 5 survivors of meningococcal meningitis are left with permanent disabilities, deafness, brain damage, or loss of limbs. The best protection you have right now is knowledge. Know the symptoms, know the signs. Do not dismiss a stiff neck and a fever in a young person as just another illness. Act early, act fast, and if you are a student in the UK who attended club chemistry in early March or who has had close contact with anyone from the Canterbury area, please contact your GP today. That is all for today's episode on BioWell Hub. If this video gave you something to think about, share it with someone who needs to hear it, because awareness truly saves lives. Hit that subscribe button so you never miss a breakdown like this one. We cover the science behind the stories that the world cannot afford to ignore. Stay informed, stay safe, and we will see you in the next one.